In the listening audience, yes, I understand the presidential race is very important, and it's fun to follow. But on a day-to-day, every moment of your waking life situation, state races are more important. The governorships are more important to you on a daily basis than the presidency. I'll argue that till I'm blue in the face. Over in Vermont, that one's gearing up to be an interesting race. You have a number of Republicans and Democrats vying for this seat. Peter Shumlin, who is going to be stepping down, or I shouldn't say stepping down, he's not seeking re-election for, I think, a third or fourth term. One of those people is pardon me, is Bruce Lisman. He's a former businessman and resident of Vermont. Good morning, Mr. Lisman. How are you?
I'm very well, thanks. Good morning to you. Happy New Year.
Happy New Year to you. You've got some good stuff here. I was reading one of your press releases that just came out. You're looking at Medicaid and saying we really need to get this audited and really look at what's going on here. I've been very critical of Medicaid because it seems to me that all the states expanded it under Obamacare, and it seems to me that Obamacare was just a way to push the costs off on property taxpayers. And Vermont already pays a crazy property tax, and under the new expansion... Yeah, it's pretty bad. And it's going to get worse under Medicaid expansion, and God forbid they do their own thing like they've been talking about.
Well, that would be their own thing was died. That's the single payer, but there's new versions emerging in this. That'll be emerging in this session. We can talk about another time. So the Medicaid expansion is an expensive proposition. First, the state didn't particularly project accurately. People came on because it's a new service with good benefits, and they don't have to pay a lot. Second, in the process of the Health Care Connect, it doesn't have the capacity to measure change in people's circumstances or other things that would affect the pool. In this case, so what we've suggested is we need more information. This is a big drag on our budget. It's a big percentage of what we consider the budget deficit. And so we suggested we need a simple thing. We need simple, but we want it accomplished soon enough, is to figure out not only whether everyone whether eligibility checks have been made, so we want to make sure that people who are not eligible are not in that pool. We also want to know who is in the pool. Are they healthier for being in the pool? Do they have access to health care for being in the pool? And we also want to know whether there's a change in the nature of the cost to, if you will, provide services for that pool. So we don't have enough information. That's the bottom line, and we need it. And so we ought to do a survey and find out who's in the pool and who's eligible and who's not.
Bruce Lisman, would you go into this audit with the idea that Medicaid should be retracted in the state of Vermont, or should it be preserved? What are your? I mean, that's a basic view. How do you see that?
Sure. Well, we've already done it, so it's very hard to remove it. But we could. First, we have a significant percentage of our population either on Medicaid or receiving Medicaid benefits, and so I think first off is. So who's in the pool? Let's be sure that everyone who's in it is actually eligible. Second would be to measure benefits in comparison to other states. We can measure reimbursement rates. That's the rate that your provider receives for providing Medicaid services to a patient. We ought to know by specialty, not just the average, which is probably 60%, but rather the total by specialty. These are all things that it's a complicated system. And so when we rolled out Medicaid expansion, not everyone understood the implications. And true enough, in our state, I don't think we completely understand the ramifications of it.
Bruce Lisman is running for governor in Vermont. You can check him out on his website. It's Lisman, Lisman, for Vermont.com. We're going to put a link on the WNTK Facebook page. I have watched, definitely, but I've watched the Medicaid in most states, but certainly in Vermont, that the number of enrollees has picked up, that there's more people involved, and obviously they expanded it. Makes sense. At the same time, I'm being told that, unemployment in Vermont's great. It's less than 5% or right at 5%. That doesn't make sense to me. If people are heavily employed and doing very well, they're getting insurance from their employers, or they're making enough money to pay for it. So my question now is, Why are we seeing people more enrolled in Medicaid if their employment is up? It sounds to me like maybe if it truly is like 4.7% unemployment, what type of jobs are filling that vacuum? Because it can't be those jobs at IBM that are paying $100,000 a year. Why would they need to be on Medicaid?
You're asking really good questions this morning. You're on your game. Well, we have a very low unemployment rate in our state for a couple of reasons. But the biggest one is that our workforce itself is declining and has been declining. We're an older state like so many others in the northern tier of the Northeast. And we have an economy that is thin outside of the greater Burlington area, but it's fairly strong in Chittenden County, which Burlington centers. If you look at the last, say, 7 or 8 years, say from 2007 to the latest set of numbers, which is the end of the summer, August, our total number of jobs is really unchanged during that long period of time. We've lost manufacturing and construction, and I would say some other high-value jobs, but we picked up jobs in the leisure and hospitality. They tend to trend toward not minimum wage, but minimum wage plus, as well as aspects of healthcare and healthcare services also generally trend toward the lower levels of income. So we've swapped out some high-value jobs for some low-value jobs. So that's one reason why the economy looks, on the one hand, robust because of low unemployment rate, but also has a large population of still people in poverty, children without enough food, and areas of the state that have, I would say, an underemployed population. So those are some of the reasons. And the issue around Medicaid expansion is, of course, if you're offering a value to people in America, they're going to grab it. And that's what they've done here.
Yeah, and I think my personal experience knowing people, especially throughout the Upper Valley, is it seems like there's a lot of part-time workers. There's a lot of people who are now working 2-3 jobs to make ends meet. They're just making ends meet. And there doesn't seem to be a real push to change that out of, it's funny, you mentioned Burlington earlier. We always think out of Burlington is really Montpelier, but there does seem to be a disconnect in the sense that Burlington has a different situation than the Upper Valley or the Southwest, and it seems like they live in a vacuum and they don't realize what's going on. One of the issues that comes up to me all the time about workforce, I use the term workforce housing. A lot of Republicans recoil on that. Sorry, but but this is affordable housing for people who are working at the median salary level, the $40,000, $45,000 a year worker. They can't find housing in the Upper Valley. There's a couple reasons for that. Number one, they're not making the pay. Some people would say Act 250 plays a big role in that also, that anytime somebody proposes some type of housing project, the Twin Rivers comes along and says, nope, can't do it. That's not Act 250. How do you work with the landscape, the traditions of Vermont, while being able to expand affordable housing? This is a major issue in the Upper Valley.
It's a major issue throughout the state. And again, I think you're on an important set of issues. Well, first of all, our state's economy is, I think, dangerously fragile, and it's taken 10 or more years to get here. It's going to take a while to get out of it. So there's no silver bullet for turning a complex economy, even if it's a small one, around. Second, as strong as Burlington-related economy is by comparison to the rest of the state, it's growing at a rate far less than the national average, so not all is perfect, even in the greater Chittenden County. This matter of affordability is really important. It shows up not just in housing, but just about everything. So the cost of living in our state, even considering, again, using heating oil in the winter and things like that make it more expensive, but the cost of living in our state is simply too high. And again, some of it's just location, but a lot of it relates to government policy. So you got fees, taxes, surcharges, and property taxes are up by $640 or so million in 5 years. All of that we pay for. It's spread around unequally, but we all pay for it. The matter of housing is really important. When we try to recruit people from out of state, they look at the cost of housing and may say, well, heck, that's too much. We're getting a similar amount of income, but really it costs too much to live in a state like that. And affordability at the, around housing relates to Act 250, of course, but it relates to a whole bunch of other things that are just embedded in, how we live. So if I were governor, we would go through the whole process and examine every single fee and surcharge, cost to engineer and other things that some we can't change, but some we can change. And as soon as we know what they are, I think we can really focus on it.
Well, I'll tell you what, we got a lot of time before now and the election, and obviously once we get through the primary season, things kind of shift to the state level. I look forward to getting you back on Bruce Lisman and talk about your campaign and what you plan on doing. And